Picture this. Sarah is sitting in a hospital chair, getting her third round of chemotherapy. The cancer treatment that's supposed to save her life is making her so sick she can barely lift her head. She's throwing up every few minutes. Nothing stays down. Not water, not crackers, nothing. The nurses tell her this is normal. But here's the shocking part. It doesn't have to be this way. There's a medication that could stop this nightmare in its tracks. A little white pill that millions of people don't even know exists. Yet it's been quietly revolutionizing how we handle one of medicine's most brutal side effects. Today, we're talking about Ondansetron, the medication that's changing lives one dose at a time. In the next few minutes, you'll discover what Ondansetron really is and why doctors call it a game changer. We'll explore how this medication works inside your body, when it's used, and what you absolutely need to know about its effects. But here's what's important: this is purely educational content. I'm not a doctor, and this isn't medical advice. Always consult with your healthcare provider before making any medication decisions. Your doctor knows your specific situation best. Think of this as your crash course in understanding a medication that could one day help you or someone you love. Let's dive into the science behind this remarkable drug and discover why it's become so essential in modern medicine. Ondansetron sounds like a complicated scientific name, but it's actually quite simple. This medication belongs to a special group of drugs called antiemetics. Think of antiemetics as your body's personal bodyguards against nausea and vomiting. The brand name you might recognize is Zofran. That's the same medication. Here's what's fascinating. Ondansetron was first developed in the 1980s by scientists who were desperately trying to help cancer patients. Before this medication existed, people getting chemotherapy would spend days violently sick. Some patients actually refused life-saving treatments because the nausea was so unbearable. Then Ondansetron came along and changed everything. Today, it's one of the most prescribed anti-nausea medications in the world. Hospitals stock it regularly. Cancer centers depend on it. And patients who once suffered in silence now have hope. Here's where things get really interesting. Your body has a chemical messenger called serotonin. Most people think serotonin only affects mood, but that's not true. Serotonin also triggers nausea and vomiting. When you're getting chemotherapy or having surgery, your body releases massive amounts of serotonin. This serotonin floods special receptors in your stomach and brain, screaming, "Time to throw up." Ondansetron works like a skilled bouncer at an exclusive club. It blocks those serotonin receptors, preventing the nausea signal from getting through. Imagine serotonin as keys trying to unlock doors that make you sick. Ondansetron changes the locks entirely. The scientific name for these receptors is 5-HT3 receptors, but you don't need to remember that. What matters is this: by blocking these receptors, Ondansetron stops nausea before it even starts. It's prevention, not just treatment. The primary use of Ondansetron is absolutely heartbreaking yet hopeful. Cancer patients getting chemotherapy face some of the worst nausea imaginable. We're talking about nausea so severe it can make people stop eating entirely. Ondansetron gives these brave fighters a chance to keep their treatments and keep their dignity. It's also crucial for radiation therapy patients who face similar struggles. But here's something that might surprise you. Ondansetron is also used after surgery. Many people don't realize that anesthesia and surgical stress can trigger intense nausea. Sometimes doctors prescribe it during pregnancy, but only in severe cases and under strict supervision. However, here's a shocking fact many people get wrong: Ondansetron doesn't work for motion sickness. That's a completely different type of nausea. Using it for car sickness or seasickness is like using a hammer to fix a computer. Wrong tool, wrong problem. Ondansetron comes in several forms, and each one serves a specific purpose. The most common form is regular tablets that you swallow with water. But here's where it gets clever. There are also dissolving tablets that melt on your tongue. These are perfect for people who are too nauseous to keep pills down. There's also a liquid version, which is great for children or adults who have trouble swallowing. In hospitals, doctors often give Ondansetron through an IV directly into your bloodstream. This works faster when someone is already vomiting. The timing is crucial too. Doctors usually give it 30 minutes before chemotherapy or surgery. This gives the medication time to block those serotonin receptors before your body gets overwhelmed. Here's what's important: this is always a prescription medication. You can't buy it over the counter. There's a good reason for this strict control, which we'll explore next. Like every medication, Ondansetron isn't perfect. The most common side effects are actually pretty mild. Many people experience headaches, constipation, or mild dizziness. These usually go away as your body adjusts to the medication. But here's where things get serious. In rare cases, Ondansetron can affect your heart rhythm. This is called quart prolongation, and it can be dangerous. That's why doctors check your heart health before prescribing it. Some people are allergic to Ondansetron and don't know it until they take it. Signs of an allergic reaction include rash, swelling, or trouble breathing. If this happens, it's a medical emergency. People with existing heart conditions need extra monitoring. The medication can also interact with other drugs, sometimes in dangerous ways. This is exactly why you need a doctor's supervision. They understand your complete health picture and can spot potential problems before they become serious. Self-medication with Ondansetron isn't just risky, it's potentially life-threatening. Here's a reality check that might shock you. Ondansetron isn't a magical cure for all nausea. It's specifically designed for certain types of nausea triggered by medical treatments. Using it for a stomach bug or food poisoning probably won't help much. The medication works best as prevention, not treatment. Think of it like an umbrella. It's most effective when you use it before the storm hits. Once you're already severely nauseous and vomiting, it becomes much harder for any medication to work. Another crucial point: never share prescription medications with others, even family members. What works safely for you might be dangerous for someone else. Their health conditions, other medications, and body chemistry could create serious problems. Drug interactions are real and can be deadly. Always tell your doctor about every medication, supplement, and herb you're taking. Even seemingly harmless things like St. John's wort can interfere with how Ondansetron works in your system. Ondansetron represents one of modern medicine's greatest victories against human suffering. This small pill has given millions of people the ability to tolerate life-saving treatments that were once unbearable. From cancer patients fighting for their lives to surgical patients recovering in peace, Ondansetron has quietly revolutionized healthcare. But remember, with great power comes great responsibility. This medication should only be used under proper medical supervision. Your doctor understands the complex balance between benefits and risks. They can determine if Ondansetron is right for your specific situation. Never attempt to self-medicate or share prescriptions with others. What saves one person's life could endanger another's. If you ever need this medication, trust your healthcare team. Ask questions, understand the risks, and follow instructions carefully. Knowledge is power, but medical expertise is irreplaceable. Together, patients and doctors can harness Ondansetron's potential while staying safe. If this video helped you understand Ondansetron better, hit that like button right now. Your engagement helps us reach more people who might desperately need this information. Drop a comment below. if you have questions about this medication or suggestions for future medical topics. Remember, while I can provide education, only your doctor can provide personalized medical advice. Subscribe to our channel for more deep dives into medications and medical topics that affect real lives. Share this video with anyone who might benefit from understanding Ondansetron better, whether they're facing medical treatments themselves or supporting someone who is. Knowledge shared is hope multiplied. And remember, in the world of medicine, being informed isn't just helpful, it can be life-changing. Stay curious, stay safe, and keep learning. Your health is worth the investment in understanding.